If you've been taking blood pressure medication for years and your numbers still aren't where they should be, what I'm about to tell you might completely change how you think about this condition. Because blood pressure isn't actually the problem. It's the alarm your body is screaming at you, trying to tell you something far more serious is happening inside your arteries right now. I'm Dr. Johnson, and over the past 24 years of clinical practice, I've worked with thousands of patients whose blood pressure wouldn't come down no matter what they tried. These weren't lazy people. These were individuals doing everything their doctors told them: low sodium diets, daily exercise, meditation apps, multiple medications. And yet, every time they checked their numbers, the frustration would hit them all over again: 140 over 90, 150 over 95, some mornings even higher. I remember one patient, Margaret, who came into my office nearly in tears. She'd been on 3 different blood pressure medications for 6 years. She'd cut out salt completely. She walked 5 days a week. She'd lost 30 pounds, and her systolic pressure was still hovering around 148. She looked at me and said, "Doctor, what am I doing wrong? Am I just broken?" That question changed everything for me. Because Margaret wasn't broken. The approach was broken. We've been treating blood pressure like it's the disease itself when it's actually just a measurement, a symptom. A warning light on the dashboard telling you the engine needs attention. And here's what almost no one talks about. You can keep putting tape over that warning light with medications, but if you don't fix what's actually malfunctioning under the hood, the problem will keep getting worse. So today, I'm going to walk you through exactly what's really causing your blood pressure to stay elevated, why the traditional advice you've been following only addresses surface level factors, and most importantly, the single most powerful way to restore healthy blood pressure naturally by fixing the root biological mechanism that's been overlooked for decades. This isn't about adding one more supplement or cutting out one more food. This is about understanding what's happening inside your blood vessels at a cellular level and giving your body what it actually needs to heal. Now, before we go any further, if this approach to blood pressure already feels different from everything you've heard before, go ahead and hit that like button because it helps more people find this information, and consider subscribing if you want medicine explained the way it should be, clearly, honestly, and without the pharmaceutical sales pitch. And definitely drop a comment with the word pressure if you want me to create a follow-up video breaking down the specific foods and daily habits that support arterial health, because I read every single comment and I create content based on what you're asking for. Let me take you back to medical school for a moment. When we learned about hypertension, we were taught a very simple model. High blood pressure happens because of too much salt, too much stress, not enough exercise, genetics, and aging. The solution? Lower the salt, manage the stress, move more, and if that doesn't work, start medications. Beta blockers to slow the heart, diuretics to reduce fluid volume, ACE inhibitors to relax the vessels, calcium channel blockers to prevent constriction. And for many people, this works well enough to keep their numbers in a safer range. But here's the problem that kept nagging at me throughout my career. I had patients who ate incredibly clean diets, barely any processed food, minimal salt, and their blood pressure was still high. I had patients who were calm, balanced, meditative individuals with resting heart rates in the 50s, and their systolic pressure was 160. I had patients in their 30s, active and fit, developing hypertension. And I had patients who ate salty foods, lived stressful lives, and had completely normal blood pressure their entire lives. So clearly, the standard model was missing something. Salt, stress, and exercise matter, yes, but they're not the core driver. They're contributing factors to a much deeper problem. And until I started asking what that deeper problem actually was, I couldn't help my patients get real, lasting results. The breakthrough came when I started focusing less on the number on the monitor and more on what was happening inside the arteries themselves. Because blood pressure is just a measurement of resistance. It's how hard your heart has to push to move blood through your vascular system. When your arteries are soft, flexible, and responsive, blood flows easily and pressure stays normal. But when your arteries become stiff, inflamed, and unable to relax properly, resistance goes up. The heart has to work harder, and that's when the numbers climb. Think of it like a garden hose. If the hose is flexible and open, water flows smoothly at low pressure. But if the hose becomes rigid, kinked, or clogged, the pressure inside skyrockets. Your arteries work the same way. The question isn't just how much water is flowing or how fast the pump is working. The question is, what's happening to the hose itself? And this is where we get to the real root cause that almost no one is talking about. The number one reason blood pressure stays elevated in the majority of patients I've treated over 2 decades is chronic endothelial dysfunction and loss of nitric oxide signaling. Now, I know that sounds technical, so let me break it down in plain language because this is the key to everything. The endothelium is the thin layer of cells that lines the inside of every blood vessel in your body. It's not just a passive barrier, it's an active, living tissue that controls whether your arteries relax or constrict. And it does this primarily through a molecule called nitric oxide. When your endothelium is healthy, it produces plenty of nitric oxide, which signals the smooth muscle around your arteries to relax. This keeps your vessels wide open, resistance low, and blood pressure normal. But when your endothelium becomes damaged or dysfunctional, nitric oxide production drops. The arteries lose their ability to relax. They stay tight and constricted. Resistance goes up, and your heart has to pump harder and harder just to push blood through. This is endothelial dysfunction, and it's the hidden epidemic driving not just high blood pressure, but heart disease, stroke, kidney disease, and even dementia. Now, here's what makes this so insidious. Endothelial dysfunction doesn't happen overnight. It builds slowly over years, driven by chronic inflammation, oxidative stress, insulin resistance, poor diet, environmental toxins, and lack of key nutrients. And because it's invisible, most people have no idea it's happening until their blood pressure is already elevated, or they have a cardiac event. By the time you're diagnosed with hypertension, your endothelium has likely been struggling for years. So when doctors prescribe blood pressure medications, what are they actually doing? They're forcing your arteries to relax through chemical intervention, or reducing the volume of fluid your heart has to pump, or slowing your heart rate down. And these interventions can be life-saving. I'm not anti-medication, but here's the critical point. If you're not also addressing the endothelial dysfunction and restoring nitric oxide production, you're just managing the symptom. The underlying damage continues, and often over time you need more medications or higher doses because the root problem is still getting worse. This is why so many people feel stuck. They're doing everything their doctor recommends. They're taking their pills every single day, and their blood pressure is technically controlled on paper, but they don't feel healthy. They're tired. They're worried about side effects, and they wonder if they'll be on these medications forever. The answer is probably yes, unless you address what's actually broken. So let's get to the most important question. What is the single best way to naturally lower blood pressure by restoring endothelial function and nitric oxide production? After decades of clinical experience, reviewing thousands of research studies, and seeing what actually works in real patients, here's my answer. The number one most powerful natural intervention is to consistently support your body's ability to produce and utilize nitric oxide through targeted nutritional strategies, specific movement patterns, and strategic lifestyle modifications that directly impact vascular health. Now, I know that sounds broad, so let me get specific. There are 3 primary pathways your body uses to generate nitric oxide. Pathway number 1 is through the amino acid L-arginine, which gets converted into nitric oxide by an enzyme called nitric oxide synthase. Pathway number 2 is through dietary nitrates, which are converted into nitrite and then into nitric oxide, especially in low oxygen environments. And pathway number 3 is through mechanical stimulation of the endothelium, which happens during physical activity when blood flow increases and creates shear stress on the vessel walls. Here's the problem. As we age, as inflammation increases, as insulin resistance develops, all 3 of these pathways become impaired. Your body produces less nitric oxide synthase, your ability to convert nitrates becomes less efficient, and your endothelium becomes less responsive to mechanical stimulation. This is why blood pressure tends to rise with age. It's not just because you're getting older, it's because your nitric oxide system is breaking down. But here's the exciting part. You can rebuild this system. And when you do, blood pressure often starts to normalize without ever touching medication, or it allows you to reduce your medication dosage significantly under medical supervision. I've watched this happen hundreds of times. Patients who thought they'd be on pills forever, suddenly seeing their numbers drop into the 120s over 70s naturally because we fixed the underlying biology. So, how do you actually do this? Let me give you the practical framework. First, you need to provide your body with the raw materials it needs to produce nitric oxide. This means adequate intake of L-arginine and L-citrulline, which are amino acids found in foods like watermelon, nuts, seeds, legumes, and certain fish. Citrulline is particularly powerful because it converts into arginine in the kidneys and tends to raise nitric oxide levels more effectively than arginine supplementation alone. Studies have shown that citrulline can significantly reduce both systolic and diastolic blood pressure in people with prehypertension and hypertension. Second, you need to consume foods rich in dietary nitrates. The best sources are leafy greens like arugula, spinach, and beet greens, as well as beets themselves. When you eat these foods, bacteria in your mouth convert the nitrates into nitrite, which then gets converted into nitric oxide in your bloodstream and tissues. This is why some studies have shown that drinking beet juice can lower blood pressure within hours. It's providing a direct substrate for nitric oxide production through a pathway that doesn't rely on the enzyme that often becomes dysfunctional. But here's a critical mistake people make. They think they can just eat some beets or take a supplement and fix everything. It doesn't work that way. If your endothelium is severely damaged by chronic inflammation and oxidative stress, it doesn't matter how much raw material you provide. The system is too broken to use it effectively. So the third piece is reducing the inflammation and oxidative damage that's destroying your endothelial cells and inactivating nitric oxide. This is where most people's diets are sabotaging them without realizing it. Ultra-processed foods, refined carbohydrates, seed oils, and high sugar intake all drive chronic inflammation and oxidative stress. Every time you eat these foods, you're creating a cascade of inflammatory signals and free radicals that attack your endothelium and destroy nitric oxide molecules before they can do their job. It's like trying to fill a bucket with holes in it. You can keep pouring in more nitric oxide precursors, but if the system is inflamed and oxidized, it won't matter. So, a huge part of lowering blood pressure naturally is removing the foods and habits that are constantly damaging your vascular system. This means drastically reducing or eliminating processed foods, minimizing refined carbohydrates, avoiding industrial seed oils, and controlling blood sugar spikes. When patients make these changes, even without adding anything new, I often see blood pressure start to improve within weeks because we've stopped the daily assault on their arteries. Now let's talk about the fourth component, which is often overlooked: mineral balance. Your body needs adequate magnesium, potassium, and calcium in the right ratios to regulate vascular tone and blood pressure. Magnesium in particular is critical because it acts as a natural calcium channel blocker, helping your arteries relax. It's also required for nitric oxide production. And here's the problem. Most people are magnesium deficient. Modern soils are depleted. Food processing removes it. Stress depletes it. Medications like diuretics and proton pump inhibitors deplete it. And when magnesium is low, your blood vessels stay constricted and your blood pressure stays high. The same is true for potassium. Potassium helps balance sodium levels and supports healthy arterial function. But most people eating a modern diet get far too little potassium and too much sodium. Not because salt is inherently evil, but because processed foods are loaded with sodium and devoid of potassium. When you shift to a whole foods diet rich in vegetables, fruits, legumes, nuts, and seeds, you naturally correct this imbalance, and blood pressure often improves as a result. Now, here's where movement comes in, and this is the fifth critical piece. Exercise is not just about burning calories or losing weight. It's about creating the mechanical stimulus that tells your endothelium to produce more nitric oxide. When you move, blood flow increases. This creates something called shear stress on the walls of your arteries. Your endothelial cells sense this stress and respond by producing nitric oxide to help the vessels dilate and accommodate the increased flow. This is why regular physical activity is one of the most powerful blood pressure lowering interventions we have. But not all exercise is equal for this purpose. The research shows that moderate intensity, aerobic exercise, resistance training, and even short bursts of high-intensity interval training all improve endothelial function and nitric oxide production. The key is consistency. You're essentially training your endothelium to be more responsive and produce more nitric oxide on demand. Over time, this leads to lower resting blood pressure, improved arterial flexibility, and better overall cardiovascular health. And here's something fascinating that most people don't know. Even small amounts of movement throughout the day can have a significant impact. Sitting for long periods causes blood flow to stagnate and endothelial function to decline. But simply standing up, walking around, or doing light movement every 30 to 60 minutes can prevent this decline and keep your nitric oxide system active. This is why I tell patients that being active throughout the day is just as important as their dedicated workout sessions. The sixth factor, and this one surprises people, is oral health. Remember how I mentioned that bacteria in your mouth convert dietary nitrates into nitrite? Well, if you're using antibacterial mouthwash twice a day, you're killing those beneficial bacteria. Studies have shown that using antiseptic mouthwash can actually increase blood pressure because it disrupts the nitrate to nitrite conversion pathway. So, if you're eating all the right foods but rinsing with strong mouthwash multiple times a day, you're literally washing away one of your body's natural blood pressure lowering mechanisms. Now, let's talk about stress, because I know people are wondering where this fits in. Stress absolutely affects blood pressure, but not in the way most people think. Acute stress causes temporary spikes in blood pressure through adrenaline and cortisol release. That's normal. The problem is chronic, unrelenting stress that keeps your nervous system in a heightened state day after day. This doesn't just raise blood pressure through hormonal mechanisms, it also increases inflammation, depletes magnesium, impairs sleep, and damages endothelial function. So, yes, managing stress is important, but it's not a magic bullet. You can meditate every day and still have high blood pressure if your diet is terrible and your endothelium is damaged. The most effective stress management for blood pressure isn't about eliminating all stress from your life, which is impossible. It's about activating your parasympathetic nervous system regularly through practices like deep breathing, meditation, time in nature, quality sleep, and social connection. These practices help lower baseline cortisol levels, reduce inflammation, and support endothelial repair. But they work best when combined with the nutritional and movement strategies we've been discussing. Now I want to address sleep because this is another massive factor that gets overlooked. Poor sleep, especially sleep apnea, is one of the most underdiagnosed causes of treatment-resistant hypertension. When you stop breathing repeatedly during the night, oxygen levels drop, carbon dioxide builds up, and your body releases stress hormones to wake you up enough to start breathing again. This happens dozens or even hundreds of times per night. The result is chronic sleep deprivation, elevated cortisol, increased inflammation, and persistently high blood pressure that doesn't respond well to medications. If you snore loudly, wake up gasping, feel tired despite sleeping 7 or 8 hours, or have been told you stop breathing during sleep, you need to get evaluated for sleep apnea. Treating sleep apnea with a CPAP machine or an oral appliance can lower blood pressure by 10 to 15 points or more in some patients. It's one of the most dramatic interventions I've seen. And it makes sense because you're finally allowing your body to get restorative sleep without the constant stress response from oxygen deprivation. Let me talk about something else that almost no one discusses: insulin resistance and metabolic dysfunction. Your metabolism and your vascular health are intimately connected. When you eat a high carbohydrate, high sugar diet, your body constantly releases insulin to manage blood sugar. Over time, your cells become resistant to insulin's signals. Blood sugar stays elevated, insulin stays elevated, and this creates a cascade of problems that directly damage your endothelium and raise blood pressure. High insulin levels promote sodium retention by the kidneys, which increases blood volume. High insulin stimulates the sympathetic nervous system, which raises heart rate and constricts blood vessels. High blood sugar creates oxidative stress and glycation, which damages arterial walls. And insulin resistance is almost always accompanied by chronic inflammation, which, as we've discussed, destroys nitric oxide and impairs endothelial function. This is why people with metabolic syndrome, prediabetes, or type 2 diabetes have much higher rates of hypertension. The two conditions are driven by the same underlying metabolic dysfunction. So if you want to lower blood pressure naturally, you have to address insulin resistance. This means reducing refined carbohydrates, eliminating added sugars, eating adequate protein, including healthy fats, and potentially incorporating strategies like intermittent fasting or time restricted eating. When patients improve their metabolic health, their blood pressure almost always improves as well, often dramatically. I've had patients drop from 150 over 95 to 125 over 75 just by reversing their insulin resistance through dietary changes. Now, let's talk about specific nutrients beyond what we've already covered that have strong evidence for supporting healthy blood pressure. Omega-3 fatty acids from fish oil or algae oil have been shown in multiple studies to reduce blood pressure, decrease inflammation, and improve endothelial function. The mechanism involves reducing inflammatory signaling molecules and supporting the production of compounds that help blood vessels relax. A typical effective dose is around 2 to 3 grams of combined EPA and DHA per day. Coenzyme Q10 or CoQ10 is another nutrient that shows consistent benefits. CoQ10 is a powerful antioxidant that protects the endothelium from oxidative damage and helps mitochondria produce energy efficiently. Studies have shown that CoQ10 supplementation can reduce systolic blood pressure by 10 to 15 points in some people, particularly those who are deficient. And here's an important point. If you're taking a statin medication to lower cholesterol, you're likely depleting your CoQ10 levels because statins block the same pathway that produces CoQ10. This could be one reason why some people on statins experience muscle pain and fatigue. Supplementing with CoQ10 can help restore levels and may improve blood pressure and overall cardiovascular function. Vitamin D is another critical nutrient that's often overlooked. Vitamin D receptors are present throughout the cardiovascular system, and adequate vitamin D levels are associated with better blood pressure control. Vitamin D helps regulate the renin-angiotensin system, which controls blood pressure and fluid balance. It also reduces inflammation and supports endothelial health. If your vitamin D level is below 30 nanograms per milliliter, there's a good chance it's contributing to elevated blood pressure. Optimizing vitamin D, typically through supplementation of 2,000 to 5,000 international units per day, depending on your levels, can make a measurable difference. Garlic is one of the most studied foods for cardiovascular health, and the evidence is compelling. Aged garlic extract in particular has been shown to lower blood pressure, reduce arterial stiffness, and improve endothelial function. The active compounds in garlic, including allicin and sulfur-containing molecules, help stimulate nitric oxide production and reduce oxidative stress. Some studies have shown reductions in systolic blood pressure of 8 to 10 points with consistent garlic supplementation. Fresh garlic consumed regularly in food also provides benefits, though aged garlic extract tends to be more concentrated and standardized. Hibiscus tea is another powerful natural intervention that doesn't get enough attention. Multiple clinical trials have shown that drinking hibiscus tea daily can lower blood pressure as effectively as some medications in people with mild to moderate hypertension. The mechanism involves AC inhibition, similar to a class of blood pressure drugs, as well as diuretic effects and antioxidant activity. Drinking 2 to 3 cups of hibiscus tea per day has been shown to reduce systolic pressure by 7 to 8 points and diastolic pressure by 3 to 4 points on average. Dark chocolate and cocoa, when consumed in the right form, also support healthy blood pressure. The flavonols in cocoa stimulate nitric oxide production and improve endothelial function. Studies have shown that consuming dark chocolate with at least 70% cocoa content or taking a cocoa extract supplement can modestly reduce blood pressure. The key is choosing products with minimal sugar and high flavanol content. This isn't permission to eat candy bars. It's about strategic use of a specific compound that supports vascular health. Now, I want to address medications directly because I know many of you watching this are already on blood pressure medication and wondering if you'll ever be able to stop. Here's my perspective after 24 years in clinical practice. Medications can be life-saving. If your blood pressure is dangerously high, like 180 over 100, you need medication immediately to prevent stroke, heart attack, or kidney damage. There's no question about that, and some people have genetic or structural factors that mean they'll always need medication for optimal control. But for many people, medication becomes a crutch that allows them to avoid addressing the root causes. They take their pill every morning and feel like they've handled the problem. Meanwhile, their diet is still terrible, they're not exercising, they're stressed and sleep deprived, their endothelium is still damaged, and over time they need more medication or develop side effects or other health problems because the underlying dysfunction is still progressing. The ideal approach, in my opinion, is to use medication when necessary to keep you safe, while simultaneously implementing every natural strategy we've discussed to address the root cause. As your vascular health improves, as inflammation decreases, as endothelial function is restored, your blood pressure will often start to come down. At that point, you can work with your doctor to gradually reduce medication dosages. I've had many patients successfully reduce or even eliminate blood pressure medication this way. But this must always be done under medical supervision. Never stop or change your medication on your own. Let me also address alcohol because this is a common question. Small amounts of alcohol, particularly red wine, have been associated with cardiovascular benefits in some studies, likely due to the polyphenols and resveratrol content. However, regular alcohol consumption beyond very moderate levels, meaning more than 1 drink per day for women or 2 for men, can raise blood pressure and damage the cardiovascular system. If you're serious about lowering your blood pressure naturally, reducing alcohol intake is one of the most impactful changes you can make. Many of my patients have seen significant blood pressure reductions simply by cutting back from several drinks per week to 1 or 2 or none. Caffeine is another area of confusion. Caffeine causes acute, temporary increases in blood pressure, usually lasting a few hours. However, regular coffee consumption doesn't appear to cause chronic hypertension in most people. In fact, coffee is rich in polyphenols and antioxidants that may support cardiovascular health. The key is moderation and paying attention to your individual response. If you notice your blood pressure spikes significantly after coffee, or if you're consuming large amounts of caffeine throughout the day, it's worth experimenting with reduction. But for most people, moderate coffee intake, meaning 2 to 3 cups per day, is not a major driver of hypertension. Now let's talk about what realistic expectations should be. I've had patients who implement everything we've discussed and see their blood pressure drop 15 to 20 points within a month or two. I've had others where the changes are more gradual, taking 3 to 6 months to see significant improvement. And I've had some patients who do everything right and still need medication, but they're able to reduce their dosage and avoid needing multiple drugs. The results depend on how damaged your vascular system is, how long you've had high blood pressure, your genetics, and how consistently you implement these strategies. But here's what I can tell you with confidence. If you address endothelial dysfunction, restore nitric oxide production, reduce inflammation, optimize mineral balance, support metabolic health, move your body regularly, manage stress effectively, and sleep well, your blood pressure will improve. Maybe not to perfect levels immediately, but it will move in the right direction. And more importantly, you'll be addressing the root cause that drives not just hypertension, but all cardiovascular disease. You'll be protecting your heart, your brain, your kidneys, and your overall longevity. The mistake most people make is trying to find the one magic bullet, the one supplement or food or exercise that will fix everything. But blood pressure regulation is complex and multifactorial. It involves your diet, your metabolism, your nervous system, your sleep, your stress levels, your activity patterns, your nutrient status, and your vascular health all working together. You can't just fix one piece and expect everything to normalize if the other pieces are still broken. This is why a comprehensive approach is essential. Let me share a patient story that illustrates this perfectly. I had a man named Robert who came to me at age 56 with blood pressure that averaged 152/96, despite being on 2 medications. He was frustrated and worried about his future. His father had died of a heart attack at 62. Robert was determined not to follow the same path. We spent an hour going through his entire lifestyle, and it became clear that multiple factors were driving his blood pressure up. His diet was heavy in processed foods and light on vegetables. He was pre-diabetic. He was getting only 5 to 6 hours of sleep per night due to work stress. He wasn't exercising consistently, and he was about 30 pounds overweight. We created a plan together. Not a restrictive diet, but a sustainable shift toward whole foods with plenty of leafy greens, beets, berries, nuts, fish, and legumes. We added a magnesium supplement and omega-3 fish oil. We worked on improving his sleep by setting a consistent bedtime and limiting screen time before bed. He started walking 30 minutes every morning before work. And he began practicing 10 minutes of deep breathing every evening to activate his parasympathetic nervous system. Within 6 weeks, his blood pressure had dropped to 138 over 86. Within 3 months, it was 128 over 80. His doctor reduced one of his medications. By 6 months, Robert was at 122 over 78 on a single low dose medication, and he'd lost 23 pounds without ever feeling deprived or hungry. His energy was better, his sleep was better, his blood sugar had normalized, and he told me he felt like he'd gotten his life back. That's what happens when you fix the root cause instead of just chasing the number. Robert's blood pressure came down because his endothelial function improved, his inflammation decreased, his metabolism healed, and his nervous system found balance. The medication was still there as a safety net, but his body was doing most of the work now because we'd given it what it needed to heal. Let me address one more critical point that often gets missed. Blood pressure naturally varies throughout the day. It's typically lowest during sleep, rises in the morning, and fluctuates based on activity, stress, food intake, and hydration. This is normal. The problem is when your baseline is chronically elevated. So if you're checking your blood pressure multiple times a day and obsessing over every reading, you're actually creating more stress, which can raise your blood pressure. Check it consistently at the same time each day, typically in the morning before eating or taking medication, and track the trend over weeks, not individual readings. Also, make sure you're measuring correctly. Use a properly sized cuff. Sit quietly for 5 minutes before measuring. Keep your arms supported at heart level. Don't talk during the measurement, and take 2 or 3 readings a few minutes apart and average them. Improper technique can give you falsely high or low readings that cause unnecessary anxiety or missed diagnoses. I also want to talk about white coat hypertension, which is when your blood pressure is elevated in the doctor's office but normal at home. This is incredibly common and is driven by the stress and anxiety of being in a medical setting. If this is you, consider getting a home blood pressure monitor so you can track your actual baseline. Many doctors now recognize white coat hypertension and won't start medication based solely on office readings if your home readings are consistently normal. However, studies have shown that people with white coat hypertension are at higher risk of developing sustained hypertension over time, so it's still worth implementing the preventive strategies we've discussed. Conversely, some people have masked hypertension, where their blood pressure is normal in the office but elevated at home or during daily activities. This can be more dangerous because it goes undiagnosed. If you have risk factors for high blood pressure but your office readings are normal, it's worth checking at home periodically to make sure you're not in this category. Let's talk about what to do if you've been following all these recommendations and your blood pressure still isn't budging. First, give it enough time. Vascular healing doesn't happen overnight. 3 to 6 months of consistent implementation is a reasonable time frame to expect meaningful results. Second, consider whether there might be a secondary cause of hypertension. Conditions like sleep apnea, kidney disease, thyroid disorders, primary aldosteronism, and certain medications can all cause elevated blood pressure that won't respond to lifestyle changes alone. If your blood pressure remains resistant despite your best efforts, work with your doctor to rule out these underlying causes. Third, assess whether you're actually being as consistent as you think. It's easy to convince ourselves we're doing everything right, when in reality, we're still having processed food several times a week, skipping workouts regularly, staying up too late, or not managing stress effectively. Keep a journal for a week or two and honestly track your food, movement, sleep, and stress. You might be surprised by what you discover. And finally, remember that genetics do play a role. Some people are more predisposed to high blood pressure due to their genetic makeup. This doesn't mean you're doomed, but it might mean you need to be more diligent with lifestyle factors, or that you'll need a low dose medication even when doing everything else right. And that's okay. The goal is optimal health and longevity, not perfection or avoiding medication at all costs. Let me share some practical tips for implementing everything we've discussed. Start with food. Build your meals around whole, unprocessed foods. Fill half your plate with vegetables, especially leafy greens and colorful varieties. Include a palm-sized portion of protein from fish, poultry, eggs, or legumes. Add a source of healthy fat like olive oil, avocado, nuts, or seeds. Include a moderate amount of whole food carbohydrates like sweet potatoes, quinoa, or fruit. This template automatically gives you the nutrients, minerals, and compounds that support vascular health while minimizing the inflammatory foods that damage it. For movement, aim for at least 30 minutes of moderate activity most days of the week. This could be brisk walking, cycling, swimming, or any activity that gets your heart rate up and makes you breathe harder. Add in resistance training 2 to 3 times per week to build muscle and improve metabolic health. And remember to move throughout the day, not just during your workout. Set a timer to stand and stretch every hour if you have a desk job. For stress management, find what actually works for you. This might be meditation, but it could also be time in nature, a hobby you love, quality time with friends or family, journaling, or prayer. The key is regular practice, even if it's just 10 minutes a day. And prioritize sleep. Aim for 7 to 9 hours per night in a dark, cool, quiet room. Stick to a consistent sleep schedule. Limit screen time before bed, and address any sleep disorders like apnea. For supplements, consider starting with the basics. A high-quality omega-3 supplement providing 2 to 3 grams of EPA and DHA, magnesium glycinate or threonate at 300 to 400 milligrams daily. Vitamin D based on your blood levels, but typically 2,000 to 5,000 international units. And CoQ10 at 100 to 200 milligrams if you're over 40 or on a statin. You can add targeted nutrients like aged garlic extract, beetroot powder, or citrulline based on your specific needs and budget. Track your progress by checking your blood pressure consistently at home and keeping a log. Also pay attention to how you feel. Improved energy, better sleep, reduced anxiety, and enhanced physical performance are all signs that your vascular health is improving, even if the blood pressure numbers haven't fully normalized yet. Now, before we wrap up, I want to leave you with this perspective. High blood pressure is not a life sentence. It's not a reflection of your worth or your willpower. It's a biological dysfunction that developed over time due to a combination of genetics, environment, diet, and lifestyle. And just as it developed over time, it can be reversed or significantly improved over time when you address the root causes. You have far more control over your vascular health than you've been led to believe. Your body wants to heal. Your endothelium wants to produce nitric oxide. Your arteries want to be flexible and responsive. You just have to give your body the right conditions and raw materials to make that happen. The path forward is not about perfection. It's about progress. It's about making better choices more often. It's about understanding what's really happening inside your body so you can work with your biology instead of against it. And it's about being patient with yourself as your body heals because healing takes time. But every healthy meal you eat, every walk you take, every good night of sleep you get, every stress management practice you engage in, you're supporting your vascular health. You're producing more nitric oxide. You're reducing inflammation. You're protecting your endothelium. And over time, those small, consistent actions compound into meaningful, lasting change. If this video has given you a new understanding of blood pressure and what to do about it, please hit that like button so more people can find this information. And if you want me to create a follow-up video going even deeper into specific foods, meal plans, supplement protocols, or exercise routines for blood pressure management, drop a comment right now with the word pressure, and I'll know there's interest. I read every comment and I create content based on what you're asking for. Subscribe to this channel if you want more evidence-based, straightforward medical information without the pharmaceutical sales pitch or fear-mongering. I'm here to educate and empower you to take control of your health. Thank you so.